My armamentarium for this skill assessment is my PPE, my Marquis probe, my dental mirror, and my floss. There are also 2 other probes that can be used if needed, the UNC-12 and the neighbor's probe, which is used for furcations. The Marquis probe is a double-ended, unpaired assessment instrument that is used subgingivally. It has a flexible, simple shank that is circular in cross-section. It has a blunt and rod-shaped tip with no cutting edges. It measures pocket depths up to 12 millimeters, and the different colors indicate every 3 millimeters. The Marquis probe is used to determine the overall health of the periodontium. It measures the sulcus and pocket depths up to 12 millimeters. It measures the clinical attachment loss or recession, the width of attachment. It assesses for bleeding. It measures intra and extraoral lesions. It determines mucogingival relationships, and it monitors the longitudinal response of periodontal treatment. Clinical attachment loss has 3 parts: normal, recession, and overgrowth. Normal measures from the gingival margin to the base of the sulcus. Recession measures the cemento-enamel junction to the gingival margin first, and then the gingival margin to the base of the sulcus second, and those 2 numbers are added together. Overgrowth is the measurement of the gingival margin to the CEJ, and then the gingival margin to the base of the sulcus, and those numbers are subtracted from each other. To determine the width of attachment, it is determined in 2 parts. First, you take the measurement of the mucogingival junction to the gingival margin, then insert the probe to measure from the gingival margin to the base of the sulcus. Here I am checking for open contacts with my floss. Any open contacts can be measured with the probe. Here I am also checking the frenums to make sure there is no abnormalities in the attachment. To check for mobility, we use 2 single-ended blunt instruments to essentially rock the tooth back and forth. We can classify the mobility in 3 grades. Mobility grade 1 is slight movement, typically less than 1 millimeter in a horizontal direction. Grade 2 mobility is more pronounced movement. It is greater than 1 millimeter but less than 2 millimeters in a horizontal direction. And mobility grade 3 is the most severe mobility. It's characterized by movement greater than 2 millimeters in any direction, horizontal or vertical. The picture above is of a neighbor's probe. It is used for furcation involvement. There are 4 furcation stages. Stage 1 is where the bone loss begins. The neighbor's probe is slightly inserted, no more than 1 millimeter. Furcation 2, the probe can penetrate further into the furcation. It is greater than 1 millimeter but does not pass completely through the roots. Stage 3, the probe does pass completely through the furcation, but the opening may not be visible due to the soft tissue still present. Furcation 4, the probe passes completely through and the opening is clinically visible due to the significant gum recession.